started working at Kaiser Fontana in 1964. We started UNAC at Fontana in late 1971, early 1972. We had 120 RNs. 119 of them voted for UNAC and 1 voted no. Our union grew and it continues to grow.
That was my sister, and I miss her dearly. Kathy Sackman taught me, and we learned together all about the union and how we could make it better. But in addition to that, we spent so much time together. I was a bridesmaid for her wedding. She was a bridesmaid for my wedding. That's how close we were. And even though we were very, very close, much of our time was spent talking about the union. That's what really drove us and put us together. That was her life, that was my life, the union.
I first met Kathy in 1997 as a coalition of unions at Kaiser were starting to think about starting a labor management process with Kaiser. What immediately struck me about Kathy was her deep caring for her members, for patients, and her openness to consider having an opportunity to have a partnership with Kaiser. The prospect of increasing decision-making for frontline staff seemed very appealing to Kathy, although she was quite skeptical, I might add, that Kaiser was really serious about developing such a partnership process. Might still be the case. She still might be skeptical about what they're doing. I deeply miss Kathy. She was a good friend. She left UNAC in great hands with Denise and her leadership team. And I will always remember my great times with her.
Kathy Sackman and I were more than just colleagues. We became very personal friends. I can remember the time that we first met in the mid-1990s out in front of the AFL-CIO building on the day that we actually agreed to form the Coalition of Kaiser Unions and began to explore the uniqueness of the labor management partnership. And I think it's important to understand the courage of leadership it took to step out and do something so uniquely different. It was a style and a leadership quality that Kathy displayed through all of the time that we worked together. And it wasn't just within the coalition and wasn't just within Kaiser. She provided that leadership within her own union, AFSCME. I think the other important thing to really grasp is the magnitude of the impact we had on the patients that we cared for. Keep in mind that we're talking about millions of patients, millions of families that were impacted in the work that we did. Kathy was more than a colleague, she was a friend, and I will tell you that she will be deeply missed.
Kathy Sackman was a force of nature. She built the foundation of healthcare unionism brick by brick. It was her vision and her passion that made UNAC UHCP into the powerhouse it is today. Kathy was fearless at the negotiating table, a proud trade unionist. She understood the importance of collective bargaining, not just so nurses and healthcare professionals could enjoy a better life, but so they could meet their solemn obligation to provide the best possible care. In a 1990 speech to the National Nurses Congress, Kathy said this: "We as nurses have a noble and wonderful profession that calls for the best that's within the human heart." And I know she believed that was true of all healthcare professions. That's why she fought with such ferocity to improve working conditions, to raise standards, to ensure safe staffing, to secure the dignity and respect that nurses and healthcare professionals have unquestionably earned. Rest in power, sister. We will do our very best to carry on your legacy.
Madam Speaker, I rise in memory of Kathy J. Sackman, a pioneer in the labor movement as well as a registered nurse and founder of the United Nurses Associations of California, Union of Healthcare Professionals. She was a frontline nurse who worked in critical care units that saw that the adverse treatment of nurses led to worse outcome for patients. And I asked her simply one day, why did you start the United Nurses Association of California, Union of Healthcare Professionals? And she said simply, I saw that the nurses were being treated very differently than the doctors. We didn't even have dental, and they did. One of the things that we tried to remind people, she told me, is that the wins that we have achieved tend to be forgotten over the years. That the pay for nurses, that the staffing ratio for nurses, that the way nurses are viewed today has always been so. And she said that that was not always the case. And that's why they fought to organize, they fought for their patients. She also understood that if you don't treat the nurses well, then the patients are not treated well. If you have 10 patients for one nurse, well, there's no way that those patients can get the quality care that they deserve. She always put members first, nurses first, the community first, the hospital first, because she knew if the hospital did well, that the nurses will do well. If the nurses do well, patients do well. She will always have a lasting legacy as long as we continue to fight for patients, for nurses, and for our communities. So with that, Madam Speaker, I will yield back.
The union certainly has been what has kept us together, and we talked a lot about it, and I tell you, she's going to be missed. But the one thing that she always said, and I totally agreed, is that this union has to be strong and must be strong in order to survive. And as she has seen, and as I have seen, they are carrying on. They're in Northern California, they're in Hawaii, and when we started, we never dreamed of being there, and yet it happened, and we both have lived to see it. Kathy was a great leader, but to many of us, she was family, and we will miss her dearly.
We must continue to work together with our union brothers and sisters, and together with our communities, continue to move forward together